This lecture is going to be on an introduction to potassium and hypokalemia. Potassium is acquired from the diet, and within the body, potassium is primarily an intracellular cation due to the effects of the sodium-potassium pump. The kidneys are highly efficient at excreting potassium, and that's because too much potassium is deadly. Muscle tremors can be seen if the potassium concentration exceeds 8 milliequivalents per liter, and conversely, muscle weakness and muscle cell lysis can be seen with marked hypokalemia. Potassium excretion by the kidney is primarily dependent upon 4 things. Most of the potassium is resorbed by the proximal convoluted tubule. However, this resorption can be decreased with an increased flow rate through the tubule. If the body has too much potassium, then the distal convoluted tubule and the collecting ducts can excrete potassium in the ultrafiltrate. And this excretion is dependent upon adequate numbers of functioning tubules and aldosterone. If there are too few functioning tubules, or if aldosterone activity is low, then potassium is not excreted. And lastly, the urinary tract must be intact for potassium to be excreted from the body. The 3 broad categories for hypokalemia are decreased intake, increased loss, and shifting from the extracellular fluid to the intracellular space. Potassium can be lost through the GI tract, the kidneys, or the skin. Potassium loss by salivation or through sweat requires historical or physical exam findings to be suspected. Potassium loss by vomiting is supported by the presence of a metabolic alkalosis. Potassium loss with diarrhea would be supported by the identification of a secretional metabolic acidosis. Sequestration of electrolytes and water in the GI tract may result in either a metabolic alkalosis or a secretional metabolic acidosis. Diuresis causes an increased flow rate through the tubule, and this leads to decreased time for potassium resorption. Ketoanions are negatively charged, and if present in the ultrafiltrate, then they can attract the positively charged potassium and cause decreased potassium resorption. Renal failure in cats can also cause hypokalemia, but the mechanism for this isn't really known. Potassium can shift from the extracellular space into the intracellular space with a metabolic alkalosis or insulin. The top left figure shows normal concentrations of potassium and hydrogen ions in the cell and in blood. The bottom figure shows a metabolic alkalosis. And with a metabolic alkalosis, there is a decreased concentration of hydrogen ions in the extracellular space. In an attempt to normalize the blood pH, the hydrogen ions move from the intracellular space to the extracellular space, and in doing so, potassium ions move intracellularly to maintain electroneutrality. Hypokalemia due to metabolic alkalosis tends to be mild. Insulin causes glucose, potassium, and phosphorus to enter the cell. So, life-threatening hypokalemia is a potential complication of insulin therapy.